Question 17. The passage suggests that one important reason for diagnosing Alzheimer's disease in living people is B. The answer is B, to improve the treatment of victims of similar but reversible diseases. So let me show you why B is the best answer. Let's go to the passage that I've already annotated. The annotations that makes it a lot easier to see that in several places in this reading, the author tells us that there are other diseases that resemble Alzheimer's disease, such as here in paragraph 2, how CAT scans are used, but CAT scans are not really great, not good enough. But it's used to establish. It may establish certain disorders. Some of them are reversible disorders that mimic Alzheimer's disease, and so there are also other places, such as the need to exclude all these other diseases that causes dementia. And paragraph 5, here's another place where it mentions the other diseases of disorders with similar symptoms must be systematically ruled out. So there are many places in this article that tells us that there are other diseases with symptoms similar to Alzheimer's diseases. There are other diseases that resembles Alzheimer's disease, And let me jump to the most important place, the very last paragraph. And this one is easy for me to find because of my side notes here that I made it when I was reading it. Symptoms resembling those of other diseases, which is right here. Many other disorders show symptoms that resemble those of Alzheimer's disease, and it's very important to identify them and exclude them because unlike Alzheimer's disease, which is irreversible, these other diseases may be stopped or reversed with the appropriate treatment. So this is why it's important. This is one of the important reasons why it's important to identify those other diseases. If it is in fact that the patient has one of those other diseases and not Alzheimer's, because these other diseases, many of them can be stopped and can be reversed or cured, which is why it's important to identify them. So this is shown in many places in the reading. So we know that that's an important point in the reading, and also we know that B is the answer. The reason, one important reason, although the author mentions other reasons, but one important reason for studying Alzheimer's disease or for diagnosing Alzheimer's disease in living people is to improve the treatment of patients of similar but reversible diseases, and that's B. Although we're pretty sure that B is the answer, let's rule out the other three choices, just to be sure. A, physicians will then know how to handle Alzheimer's disease. That's a very general statement. And usually when you see a general statement like this as one of the choices, look through the other choices, and usually there's a more specific answer, a better answer, and in this case, that's B. So a general choice like this generally, yeah, since we have B, a better choice, we could pretty much rule out this one, the general statement of how a doctor would be able to easily know how to handle Alzheimer's patients. Okay, choice C is saying one important reason for diagnosing Alzheimer's disease is to reduce the death rate. It's for reducing the death rate of Alzheimer's patients. If you look through the reading, if you review the reading, you'll see that nowhere in the reading tells us about reducing the death rate of Alzheimer's patients. So to confirm it, I suggest that you go through the reading, and I've already done that, and it's easy to do with my annotations on the right side. So I could easily rule out C. And the same goes for D. Diagnosing Alzheimer's disease in living people, an important reason for that is to emotionally prepare patients and their families for the onset of the disease. Nowhere, like same as choice C, there's nowhere in the reading tells us about emotionally preparing patients and their families for the onset of the disease, of Alzheimer's disease. It's especially if you know the main idea of the whole reading and all the key points of the key points of the reading throughout the passage, you see that that's nowhere to be found in the reading, and some students may misunderstand one part in thinking that that choice is the answer. The part that's in paragraph 5, having patients and family frustrated. That part, if you understand the key point of this paragraph, it's about why it's frustrating to patients and family here because Alzheimer's disease is hard to diagnose. There's no specific test for Alzheimer's disease on living patients, so doctors have to rule out other diseases, and it's not 100% certain, and which is why it's frustrating to patients. So that's completely different from emotionally preparing patients and families for the onset of the disease. That's completely different. So that part of the reading does not tell us this. So this is not the answer. Another reason why some students may mistakenly choose this answer would be outside knowledge. If students with outside knowledge of diseases and genetic markers, although this article does talk about does mention genetic markers, but as a promising way to diagnose Alzheimer's, it doesn't tell us about genetic markers in helping patients and families prepare for the onset of the disease. Although if you have outside knowledge of genetic markers and diseases, you may think that D is the answer. And if that was included in this reading, then D could be the answer. But however, that was not part of this reading. The author did not go into that area. So in this case, in this reading test, D is not the answer. So having ruled out the other three choices, we know that B is certainly the answer.